You should have permission already to record. If you do not, please use the chat to request it. And with that, let's get started. Mr. County Executive, good morning to you.
Good morning, and thank everyone for joining us this week. This week I'll be talking to you from the Renaissance Hotel in DC as I'm attending the Council of Governments Board of Directors annual meeting, and this evening I'll be traveling out to Cambridge, Maryland for the MACO Winter Conference. Attending these events and talking with leaders from our neighboring jurisdictions is more important now than ever, with a lot of money being allotted for the infrastructure bill and for Build Back Better, still with Build Back Better still in limbo. I'm sure the discussions will be critical and spirited. I expect similar conversations at the MACO conference this evening and tomorrow, with the General Assembly starting in just over a month, and a special session currently meeting about redistricting and veto overrides. I'm looking forward to meeting with my counterparts from around the state. We have a lot of common issues around funding availability, what the state's going to do with its surplus. We're all finding that our budgets for school construction are not going to meet what they were intended to do because of the rapid inflation in construction prices. So we have a lot to talk about, and I think all of us have opinions about what we'd like to see the state do to help us all get through the current construction-related effects of COVID. Where am I? My computer's doing weird things. Before I begin this briefing this week, I want to extend my congratulations to the new Montgomery County Council President, Gabe Albernos, and Vice President Devin Glass as they take over and provide new leadership to the council. I've worked with both of them on numerous issues over the past 3 years, and I really look forward to working even more collaboratively over the next year. Gabe and Evan have been helpful partners, incredible leaders who are dedicated to serving this county, and I think we're going to have a good, productive year. Over the last 22 months, the executive and legislative branches have faced unprecedented challenges, and we've instituted legislation and policies designed to protect our residents, our businesses, and our employees. Together, we took steps to ensure that our county government operations did not stop during the pandemic, and we closely monitored our budget and spending. We also followed the science and data to guide us during the pandemic, and we have the highest vaccination rates still among the large jurisdictions throughout this nation. And all our work has been guided through an equity lens. We've provided food and physical relief, to tens of thousands of families, provided year-round shelter to the homeless. And that facility, this big facility we've been working on, will be opening this month, we believe. And we made our government more efficient, effective, and innovative while continuing to make progress on economic development, housing, and combating climate change. We've been successful because we've put the people of the county first. We have a lot to be proud of, but there's still more work to do. It's obvious that as COVID continues to evolve, it'll pose different kinds of challenges to us. But I'm confident that we'll build on our past success working with Council President Albernos and Vice President Glass. Case vaccination rates. This week will mark the second anniversary of when this virus first appeared in Wuhan, China, and it's responsible for 5.2 million deaths worldwide, nearly 800,000 deaths in the United States, including 1,737 deaths here in Montgomery County. These numbers are sobering and frustrating, as every time we believe the end of the pandemic is near, there is a new setback. As a nation, we're currently seeing over 100,000 cases per day. 99% of the cases right now are the Delta variant. But in 50 countries and 19 states, we now have confirmed that the Omicron variant is present. Our testing was up last week 40%, which was expected following Thanksgiving holiday gatherings. However, due to the state's MDH website being hacked, our typical reporting of data is not available this week. We're awaiting updates and answers from the state about their website outages and what the information that they do have. When is that information going to be available to us? We don't know yet. preliminary data from a report out of South Africa on Omicron this week gave us a clearer picture of what we're dealing with. Not necessarily entirely clear, but a clearer picture than what we're dealing with. And again, my screen is not functioning properly. Sorry about this. I have to hide this screen. Bear with me while I get some help here getting back to where we were. Can you give me a hand a second? There. Okay. See if I can remember that maneuver. Anyway, preliminary data from a report out of South Africa on Omicron gave us the clearer picture of what we're dealing with. But these are early Omicron observations. Last weekend, Dr. Fauci said the data was encouraging, but cautioned that more information was needed to be fully able to understand what this variant is bringing to us. South Africa is seeing a rise in COVID-19 cases attributed to this variant, as well as an uptick in hospitalizations. From this research, it shows that this variant is showing signs of immune evasion, meaning people are likely to be reinfected with the Omicron variant than they were with the variants before this. As you can see from the chart, there's a 25% risk of being reinfected after a prior COVID infection from Omicron, as compared to 12% for Beta and 9% for the Delta variants. But this report also suggests that the strain could cause a milder infection. It's too early to tell whether it poses a greater risk of death or what the long-term health effects may or may not be. However, given the relatively small amount of data and how recent the variant was detected, it's important that we be patient and recognize the limitation of what we know right now. The report also revealed that more younger people were being admitted to the hospital with the Omicron infections. The bottom line is to make sure you and your family are fully vaccinated. The vaccines do more than just prompt the creation of antibodies, but they also build the cellular response, which includes B cells and T cells. T cells in particular should be able to recognize and react to parts of the Omicron variant called epitopes, even if the spike protein is a little bit different. Pfizer and Moderna are springing into action to study potential Omicron shots, just in case they're needed. Pfizer said yesterday that their company could probably have an Omicron-specific vaccine ready by March. Other companies have given roughly the same 100 days, more or less, timetable for when new things could be available. But I believe Pfizer's also said that their testing evidence shows that this is still effective against death and hospitalization. So their vaccine is maintaining efficacy if you get the booster, and the booster is important. Whether a new vaccine is needed is going to be triggered by what we see in hospitalization rates among people who are vaccinated. If it's significantly higher with the new variant than it was in the previous variant. This is the advantage of the mRNA technology used in the Pfizer and Moderna vaccines. With the mRNA vaccine, it's easier to switch to a new variant or target a new variant than it would be with other kinds of vaccines. So it's nice to have the vaccine as added protection, and we will adjust to this new threat as we have with every other variant for the last 2 years. But to every person who thinks COVID is over and life should be back to normal, that just isn't reality. And it's certainly not the reality we're facing. Wishing it away and ignoring it didn't work from the beginning. Not a very good strategy, not very effective. When the virus was first detected, pretending that it wasn't going to be what it was led to a major disaster. Lots of unnecessary illness and lots of unnecessary deaths. But that's why now getting vaccines and boosters is so important. Vaccinations in Montgomery County, we've got 983,000 folks with at least one dose, and 850,000 fully vaccinated. We're about 81% of the population fully vaccinated. And of the population over 12 years of age, we're at 93%. Of the population over 18 years of age, we're at 93.6. And of the population 65 and older, we're at 99.1. So we continue to have high vaccination rates among our population. According to the CDC, we're at, these numbers are significant. We've also provided over 230,000 booster shots. This represents over 20% of all the boosters given in the state, which is good news. However, this is only about half of the approximately 500,000 residents that are currently eligible for boosters. And the eligible people would be those who got either Pfizer or Moderna 6 months ago or longer, or people who got Johnson & Johnson 2 months ago or longer. So if you're in that category, you're eligible for a booster. We have boosters. You do not need to use the same vaccine as was in the original doses that you got. Evidence that's coming back from the scientific community indicates that it's perfectly safe to mix vaccines and that it provides strong protection. But our top priority is just to make sure you get your booster, whatever you get or whatever you want to get. It's out there, it's available. Please come and get it. This week, we received 7,000 Pfizer pediatric doses from the state and have a first dose clinic scheduled every day this week, as well as weekend clinics. We've seen over the past 2 days that pediatric reservations have slowed down. We still have about 2/3 of our kids, 5 to 11, not vaccinated. We continue to encourage parents to make sure your kids get vaccinated. With more holiday gatherings forthcoming and winter weather pushing activities inside and the new Omicron variant looming, we have to get these shots into the arms of our children as quickly as it is possible. This week, we announced that our Emergency Rental Relief Assistance Program's application portal will be temporarily closed at 5 p.m. on Friday, December 31st. Applications submitted before the deadline will be reviewed and processed, but no additional applications will be received after that time. An additional round of rent relief funding with an updated application process will be announced soon after that. There was an article published this week in the Washington Post about our rental relief program that was inaccurate because it completely left out that this is only a temporary closure. It acts like it represented that the county was closing its rental relief portal. We are temporarily closing it, but we are going to reopen it with even more money. Our issue, it's not our issue. The fact is we have to modify the program to comport with new federal guidelines that are different than the guidelines that were being used for the previous round of rental relief that came from the federal government. And that means changing the applications. It means retraining staff on what they need to look for. We believe we can expand eligibility somewhat. So there are a lot of good things that are going to happen. Relief is going to continue. On top of that, a $34 million supplemental budget request that we sent over for emergency assistance funds was approved by the council yesterday. So we're going to have our own money. We're going to have more federal money. And we're looking forward to continuing this program. But it is not stopping. And so anybody out there who's afraid that this is the end of relief, and if you don't respond by the 31st, it's not true. If you're in the queue, you get treated through that, you'll get served through that program. And if you don't get into that program, we will have another one opening up for you. The portal closing is only temporary. I'm not happy that we have to pause this application process, but we just have to revamp the process to make it easier and quicker, and we're going to take advantage of this opportunity to do that. We know there are thousands of Montgomery County renters that this is applicable to, and we have to get the word out to them to get their applications in this month for the rest of this money, which we believe actually is going to be spent out by the end of the year, and get them ready if they don't get into this tranche, relieve them of the anxiety that there won't be more money, because there will be. We encourage residents who may be eligible for rental relief to submit applications before December 31st. If you need help filling out an application, you should call 311 and they'll be matched with a nonprofit partner who can help them, or they'll be contacted by a program staff member. Applications already submitted will be reviewed and processed, and residents who have already applied can check their application status on the rent relief portal on our county website at www.mc311.com/rent relief. If you received an eviction judgment from the courts or a red and white notice from the sheriff, call 311 Monday through Friday from 7 a.m. to 7 p.m. to receive help from the Department of Health and Human Services eviction prevention team in order to develop a housing plan. Alana Brand from HHS, who runs this program, is on our call today in case you have any questions about this program. We have some more good news in that our long-awaited library hours are getting restored. We are planning to begin on January 2nd. The MCPL library hours of operations at all our facilities, with the exceptions this time of the Maggie Nightingale noise and the MCCF facility, will be as follows: Monday through Thursday, 10 a.m. to 8 p.m., Friday, Saturday, Sunday, 10 a.m. to 6 p.m. I want to thank Montgomery County Public Libraries and McGeo for coming together on an agreement. More importantly, I want to thank our residents and patrons of the library for their patience as we work through to ensure that our libraries are COVID safe, accessible for both visitors and employees. Our libraries are critical gathering centers throughout the community, and many of our residents rely on them, not just for accessing the books, but for access to the internet as well. In more good news, we're announcing today that Montgomery County's home, the new Global Pandemic Prevention and Biodefense Center, launched by Connected DMV. That center will be co-located in Rockville at the U.S. Pharmacopeia offices at 12601 Twin Brook Parkway. Connected DMV spearheaded efforts to establish the Global Pandemic Prevention and Biodefense Center in response to the COVID-19 pandemic. The center's goal is to help prevent future outbreaks from becoming pandemics by developing a stockpile of human monoclonal antibodies in advance from emerging infectious diseases, and by integrating antibody distribution and delivery across the globe, the global health and pandemic prevention ecosystem. I think this is, really important. We're seeing it play out today with Omicron. Is what you see is the more unvaccinated people there are, no matter where they are in the world, it gives the virus more opportunities to mutate. The more likely, when the virus mutates, that you may wind up with a version of the virus that has problems that the previous versions didn't have, such as the greater transmissibility of the Omicron virus. So the sooner everybody, not just us, but everybody gets vaccinated, the sooner we're going to have some certainty about our ability to control COVID. So it's important the work they're doing, and we're happy to be the home to the center. Montgomery County is uniquely positioned to be the host location for the center, which aims to harness all the rich talent in critical health research, biohealth defense, and government assets required to deliver a full-scale response. The center is not only critical to the health, safety, and security of our nation, it's also an important economic development engine, and it's certainly creating jobs and opportunities in Montgomery County. Finally, I want to thank Representative Jamie Raskin for convening a food resiliency roundtable at the Tacoma Park Presbyterian Church on Monday. Joining Congressman Raskin was House Rules Committee Chair Representative Jim McGovern from Massachusetts, along with food resources providers and advocates. I was honored to be part of this important discussion. I was interested in learning firsthand about the challenges we're facing from recipients in need of food, the organizations distributing food, and the political and logistical obstacles on Capitol Hill. Food insecurity has been called the disaster within the disaster. I'd add that to rental issues. During the past 22 months, the pandemic has brought our food security needs into far greater focus. But the problem was with us long before COVID-19 arrived. The 2021 Feeding America program projected overall food insecurity rate in Montgomery County is at 11%. 11% is over 100,000 county residents. To tackle this enormous increase on demand, we created the Food Security Task Force last year to actively work to respond to food insecurity crisis facing our community. Since the beginning of the pandemic, the county has helped support over 111 food assistance providers through the creation of grants and investment in key programs such as bulk food purchasing. And the county's mission is simple. We're trying to provide food to help more people. We believe it's critical that the county preserve the progress made during the pandemic and build on the lessons learned instead of simply returning to pre-COVID food system states. We have to do better. This problem was already out there without the pandemic. When we talked to the providers, they were telling us about what they were dealing with going back before the pandemic. So we need to make sure that going forward, we're prepared to deal with food shortages in this community at an appropriate scale. Our government has unique strengths and abilities to address food system issues and has built a strong foundation for work with nonprofit and community partners. Specifically, we're going to establish a new Office of Food System Resilience to tackle the long-term big picture changes needed to bring meaningful improvements to the food system and to make permanent the expansion of coordination efforts with our nonprofit partners and public-private partners that grew out of the COVID-19 response. We've invested over $5.5 million on the local food banks to help them purchase food. The program enabled 46 access points to distribute over 7 million pounds of food to county residents. We also invested $13 million to purchase food from local wholesalers to supplement the needs of our food access providers and allow them to receive fresh produce and shelf-stable food. I want to thank the County Council for their approval yesterday of an additional $6.8 million supplemental that will fund our food security efforts going forward. An integrated food system agenda will tackle the intersections of climate, racial inequities, and the economy while maximizing the impacts of our investments and benefiting our families, farmers, and the community as a whole. It can create jobs, advance justice, fuel the economy, and progress our climate change preparedness efforts. And we continue to do regional work with MEMA, COG, and the National Capital Region to help enhance capacity, resiliency, and collaboration at the regional and state level, and to maximize federal dollars to spend and support this mission. So thank you for joining me today, and I'm now going to turn this over to Dr. Stoddard and Sean O'Donnell for their updates. I look forward to your questions.
Mr. O'Donnell, you want to go ahead and go first since you'll be going over the COVID numbers, and I'll follow right after that.
Sure, happy to. I'm going to share my screen here. And just to follow on with what the county executive said, we are waiting for some updates from the state's reporting systems to begin integrating back with the county's dashboards. What we do have current numbers on are the hospitalization levels that are happening across the county. Over the last month, we've seen an increase from 66 COVID patients in our hospitals. As of yesterday, that reported number was 130. This does correspond to the increasing case rate that we've observed across the county. It's proportional to that. Up until the last 2 days, of note, our ICU numbers had been relatively stable. However, those have started to go up a little bit also, and that may not be surprising given the increase in acute care and overall case rates. So, of course, this is something we're tracking and concerned about. This time last year, the winter spike we experienced occurred about a month earlier in November. As we've seen from Delta, we had an increase that started due to Delta in August and carried through September and October before it began to resolve here. This could be, what we're seeing now could be linked to the winter spike that we've had in the past. As you can see from the table on the left, previous spikes have been very large. We're of course hoping in Montgomery County that our vaccination levels will have a protective effect against this, but we're continuing to recommend to folks not only to complete their initial doses of vaccination if they've not done it yet, but also to come in for booster shots. Just want to share some additional data as we talk about increased case rates. Again, this is from a few days previously, but where we're looking at our case rates increasing within the county, we're seeing that they've occurred on the east portion of the county and in the Tacoma Park, Silver Spring area, but also in the north and western parts of the county. If these continue to increase, we would expect them likely to increase across the county, but this is where we're seeing the increases earlier. We're also seeing still that a majority of our cases are coming from individuals who are not fully vaccinated. So we're still strongly encouraging and asking people who have not completed their initial regimen of vaccinations to complete that. And again, as most of these cases are related to the Delta, which does cause breakthrough cases, again, we're strongly encouraging people to get the booster if they're eligible, which still remains to be quite a few people in our county. We've also looked at where infections are happening amongst our younger populations, and it does reflect what we've seen with our full population, and that is that the areas with yellow are showing higher infection rates along the western border of the county as well as the eastern border of the county. Those are the major updates we have right now. I just want to remind folks that we do have pediatric clinics that are occurring every evening at county sites, Monday through Friday. That's from 3 to 7. We do have available appointments on our website, and although we recommend an appointment for your convenience, we also have been taking walk-ins this week. We'll have additional pediatric appointments posted for the weekend and for next week very soon as well. Dr. Stoddard?
Thank you, Mr. O'Donnell. Just a couple things I want to add. So I've been obviously very closely monitoring the Omicron situation in the research associated with it. The one update that we really saw yesterday, and it actually continues into this morning, and again, I remind people that we're still less than 2 weeks from the naming of the variant, let alone having the data we'd like to have to make real firm conclusions about what it likely has in store for us here in the United States. But there were a number of antibody neutralization studies released yesterday that attempted to assess the ability of serum, sort of blood products for people who were previously vaccinated or people who had previous infection or a combination of those things, and the ability to neutralize live Omicron virus, to assess just how much existing immunity people are likely to have. And I think the results of those were not particularly great in terms of there's a lot of lost immunity amongst the populations against Omicron. It could have been a lot worse. And so there are still, for example, there were categories of people who had previously had infection plus been vaccinated, and those people still were able to neutralize the Omicron variant and would have fairly significant protection against Omicron. Similarly, I would expect that people who have had their original 2 shots and gotten a booster would have similar levels of ability to that pool of people to effectively eliminate Omicron. In populations that have only received their 2 vaccinations, or who had only received or had only contracted a previous variant before, whether it be Delta, Alpha, or the original strain, I would expect that they would have substantially less. You'd see significant numbers of breakthroughs with those, and potentially even some breakthrough in terms of protection against serious disease as well. And so data is still early. Important for us to continue to recognize that. We're continuing to see updates in that data every single day. But I would say that yesterday's information certainly is the most encouragement that I've seen, that people getting boosted will be important, if not necessary, to maintain the levels of immunity that we've seen here in Montgomery County moving forward. So as as the county executive alluded to, certainly, and Mr. O'Donnell's presentation also alluded to, we have a number of people who are eligible for boosters who do need to come in and get those boosters as soon as possible. We are certainly encouraging the FDA to, as quickly as possible, consider the application requests to expand the age range for those boosters to include those people 12 to 17 who have been previously vaccinated as early as June and July. They would be 6-month eligible at this point. And so obviously we want to make sure that those people have an opportunity to get boosted as quickly as possible, and we want the FDA to review that data as soon as they can. Obviously for the younger people who are getting their second dose now, the 5 to 11-year-olds, they'll likely have a bit more protection given how they've received the vaccinations. But obviously it would be important to analyze that data as well and consider how the boosting for those individuals will eventually work in the coming months as well. So lots to still understand about Omicron. There's some things that are obviously not so great about its transmission rate, some things that seem to be indicative of it being a potentially less severe illness in terms of both overall hospitalization, but particularly ICU and oxygenation requirements. So obviously there's a lot more for us to observe there, but sort of a mixed bag with what Omicron is showing us in South Africa and other places where it is spreading. So I would expect any time now that we will identify additional cases in Maryland. I expect that will be true through the end of the year. But I think it's really key to understand Delta will be the prevalent strain in Maryland through the end of the year, through the holiday season. So it's, we should worry very much about what we see in front of us as opposed to just worrying exclusively about what may be to come. So the only other thing I would note is we've previously talked about this. We do have a robust distribution program that we'll be putting out a release on for our rapid tests that we received from the state. We want to thank the state of Maryland for providing those rapid tests. We received about 10,000 of those. We've also, as a county, ordered about 24,000 more that we're still waiting delivery for. Our first round, as we alluded to with the Board of Health yesterday, we are distributing targeted towards at-risk populations, whether those be at risk because of their job, where they live, in terms of things like of that nature. So we are targeting those through our community groups, our minority health initiatives, our front-facing worker populations like our restaurant association, construction sites, and things like that. Those were how we will be rolling out a rapid test that we received from the state, and we'll look to expand those opportunities moving forward, as quickly as possible. So that's all I want to get to, and I don't think we have anyone else to present today, so I think it'll be question time.
All right, thank you, Dr. Stoddard. Thank you, gentlemen, for your presentations. Let's get started with the Q&A portion. First up, Dominique Maria Bonesi from WAMU. Good morning, Dominique.
Thank you, Lauren. I really appreciate it. County Executive, I know that you said you were watching the General Assembly session this week. The two bills regarding immigration and county agencies working with immigration and customs enforcement. I can recall about 2 years ago or 3 years ago, I can't even remember now, this was a huge debate in the county about the point in which those awaiting deportation were either put into county prisons or jails or not. Where does the county stand on their policy now, and might this change now that the bill is been passed?
I'm glad the bill's passed. We didn't change our previous policy. We don't hold people, arrest people for the purposes of detention. That's not what the county government does. So I'm glad to see the state's going to join us in a more enlightened policy, and we'll all move together now.
Thank you.
Thank you, Dominique. Coming up next is Jack Moore, WTOP. Good morning, Jack.
Good morning. I think this is probably for Dr. Stoddard and Mr. O'Donnell or the county executive, but a kind of a COVID data question. On the rise in hospitalizations, I think you addressed this, but I haven't had my second cup of coffee. Why now? We've had Delta for, a couple months now, and I know cases are rising. Is it just because cases are rising and that's why we're seeing a commensurate rise in hospitalizations? or is it some of the seasonality that we saw last year, except it's a month behind? Or can you kind of untease that for me?
It does appear to be proportionate to the rise in cases in the county. So I think, we're starting to see a more rapid rise in cases and spread. Again, it could be linked to those sorts of spikes you see seasonally. With the way Delta came out earlier in the end of summer, early fall, it may have pushed off the timing of when we see the spikes. It's hard to say with what we've seen with COVID. There seems to be a periodicity of how these spikes occur, and we just may be at the beginning of our next spike here.
I would only add to that, Jack. There's a couple of things I think that are happening all at the same time. So obviously we have some seasonality. So we've largely decoupled with vaccination case rate from hospitalization, but not fully decoupled, meaning if your case rate continues to go up, you would expect hospitalization to go up. Number one. Number two, we just started really doing full community-wide boosting of people who have been vaccinated months and months and months ago. And so we're probably still seeing a portion of our population having a waning immunity if they haven't been boosted yet, which is, again, another encouragement to come out and get boosted. Then also the seasonality is what's contributing to those case totals increasing, as well as some of the holidays, most recently Thanksgiving, that assuredly brought people together indoors. It's been colder. Those things are all sort of adding up to see the case rate increase, and the hospitalization rate is probably tied to just the case rate increasing, as well as a population whose immunity is waning just as we're starting to boost them. So I think those things are all contributing to the overall picture that we're seeing. Now, the rates of the hospitalization rates are still not nearly what we saw last year. I think it's important to note, but certainly it's something we're monitoring very closely when we see an increase in the hospitalization rate. That's the thing that should give us all caution about, how we proceed.
And is there kind of a moment or a threshold at which, action needs to be taken, and what would that look like?
So I think we've talked a bit about this before, and certainly I'm going to say some things that I think the county executive is going to want to chime in on here shortly. Obviously we're, the Board of Health regulation around masking has this 85% threshold. That is something we're in active conversation with the Board of Health about. I think our testimony as they were developing that bill and the associated 85% threshold, we talked a lot about having a meeting with the Board of Health later in the year to go over the information like the hospitalization data as a much more a reasonable way to proceed with the mask mandate. And so I think that we're going to be reiterating our desire for some conversation with the Board of Health prior to us reaching that 85% threshold, just to make sure that they have the most current information with regard to hospitalization and Omicron, about how it's spreading and what it may mean for us and masking and all those things. So it's not to say that we're necessarily automatically, going to make these massive changes to it. We want to make sure that we're providing them the right information so we can all be very intentional. The other thing I will mention, and this is where I think the county executive may chime in, that we have talked a lot about if we needed to implement new measures, we did not want to do closures or massive restrictions. But what has been very successful in other parts of the country are these vaccine passport programs where you utilize certain services based on vaccination status. I know the county executive is very supportive of those, and that is probably the arena of things where if things get worse, particularly in hospitalization, that's much more likely to be the things that we start to advocate and have conversations about, as opposed to the broader restrictions that we've seen that we had to utilize because we didn't have vaccines in previous surges.
Yeah. I'll just add to that a couple of things. One is, this 85% number. I don't know exactly where it came from, but I know that people kicked it around. One of the numbers that sort of represented herd immunity. The only problem with that theory is if you've got a variant that causes reinfection in the herd, then the herd's not really immune. And if that reinfection can send people to the hospital and occupy beds in the hospital, 85% alone isn't enough to tell you you've achieved what you need to achieve. And I would be very reluctant. If it was my decision, I would just wouldn't say 85% the job's done any more than I would have said if I get to 50 or fewer cases, like 49, for example, that we've accomplished our mission. Because how long did that last? A week? All it did was increase the ability for people to get infected and drive our numbers back over 50. And there we are back masked again. So before I made a decision based on a number, I'd want to look at the overall circumstances in the county. I'd want to know who's getting infected. Hopefully over the next month, we'll get better data, if not from here directly, from places that have gotten infected with this earlier than we did, about who gets infected, whether they wind up in hospitals, what's the rate of hospitalization. All those things would be really important. And I hope we make a decision based on a combination of things, not on this mythical notion of there's herd immunity, because obviously this herd is not immune. I don't believe the cases are going to go away the day we hit 85%. Not going to happen. On the other issue, I continue to be a believer we ought to have vaccination passports for going into restaurants, particularly. And, every time I've asked staff about what does contact tracing show, it keeps coming back to restaurants. We know this is the one place where people come in and they take their masks off. People do not put masks on and off between bites and drinks. It doesn't happen. It's not realistic to expect it to happen. I've actually never seen anybody actually do that. And so you're in a situation where you don't know whether the people in that room are vaccinated or not. I continue to talk to restaurant owners who lament the fact that they're not up to higher levels of occupancy. And I firmly believe, from my own talking to people who I know about what they do, or people telling me what they do, who are just relating their stories to me, people don't want to go to restaurants if everybody's unmasked. It makes people nervous. And so there are people who won't go. And if that's the case, that's keeping customers out of those stores. I think restaurants would find it easier to bring more people in if they knew that the people in the restaurant were vaccinated. Customers would know that everybody in the restaurant was vaccinated. It would lead to a greater level of confidence in people and being in places like that. I think that works. And it would be interesting to look at some of the entertainment venues that have had very large numbers of people in them, sitting relatively close to each other, but with masks, whether they show up as high sources of cases or whether they don't stand out as high sources of cases. Because if you go to a Capitol Center and they've packed 13,000 people in there, you ought to see a number. And if you're not seeing a number because everybody is required to be vaccinated before you go there, maybe that's a statement on, the value of the vaccinations. I'm just a big believer that we ought to be, in places like that, we ought to be sure that we're not opening the door to spreading it more than we need to. And I think the restaurants will get more customers, which is what they need.
Thank you, Jack.
Sorry. A vaccine passport that would, even in the county. I know that for a while there was a regional attempt, but even in the county, that would require like a Board of Health regulation, or what would be the steps to enact that?
I think the state would have to share with us the information and allow us to do this. I know they've not been friendly to this concept in the past, and ultimately require a Board of Health regulation. And I don't know yet whether we could do the health regulation and the state would let it go into effect, but I think it would be worth finding out.
Thank you.
Thank you, Jack. Good morning to you, Kevin Lewis, 7 News. You're up next with questions for the county executive, I believe.
Yeah. Hi, good morning, everyone. County Executive, on Monday, I reported on a shoplifting incident at the Safeway in Olney. Today, I'm going to report on a separate shoplifting incident at the Safeway in Kensington. It appears, based on what the staff told these eyewitnesses in both incidents, that Safeway is instructing its employees to not call the police when shoplifting incidents occur. I haven't gotten an official policy from Safeway, which is owned by Albertsons, but that's what staff are telling these eyewitnesses. As county executive, would you like retailers to call the police when there are cases of shoplifting, or do you think an internal approach is the best practice?
I think that's a decision for the retailer. I mean, if they feel these things are of such a low level that there's no need to involve the police, that they'll sustain the loss without the potential of additional police involvement or having their employees get involved in trying to retain somebody until police arrive, that may be the best decision they make. So I'm not going to second guess them if that's their choice. I just want to be sure you understand that we're not instructing anybody not to call the police. So if that's their business decision, then they must have a good reason for it.
Just as a quick follow-up, in reading some of the comments that people have, and there's a wide variety, some say that these types of policies, they fear that consumers will ultimately eat the cost of shoplifting and that it could breed more shoplifting. Your thoughts on that?
Well, I think there was always shoplifting, right? I used to work in a retail chain, and they actually said this is the amount of shoplifting that they expect to be normal. It was a certain percentage of your stock loss. And I would imagine that as long as it stays within the loss parameters that businesses expect, I'm pretty certain that in the retail industry, they do have standards for what they expect they're going to lose because they know they are. As long as it stays within their standards, they're probably okay. And if it gets outside those standards, it's going to be a problem. And that might actually change how they decide to respond to things. But it's been years since I've been inside retail as a manager, so it's a different world. I don't know.
You and I share former retail jobs. I worked at Macy's in college, so we have that in common.
I had years of Montgomery wards.
Hey, enjoy the conference. Thanks so much.
You too.
Thank you, Kevin. Megan Rivers, WSA 9, you had posted a question in the chat, but I believe that now you want to ask a question as well. So go ahead. Good morning.
Yeah, good morning. Just wanted to get those numbers for the rental relief program. You said that the county had secured federal funds as well. So wanted to get those numbers again. You said them kind of.
So I'm not sure I've memorized. Is Alana on this call?
Yeah, I'm here.
Okay.
So in ERA 1 funds, we received 31 million in direct allocation, and we received 28 million as a pass-through from the state of Maryland. ERA 2 funds, we have received already our 34 million in direct allocation to the Treasury Department, and that is the special appropriation that the county executive referenced was passed yesterday. We anticipate that the state of Maryland will share its funds again with ERA 2, but they have not made announcements yet as to what each local jurisdiction will be receiving from their funds.
Okay, thank you so much. And then one follow-up question about COVID related to the rental relief is like right now we have a situation at Paint Branch High School where there's an outbreak with students and teachers and faculty and staff who have contracted COVID. So when we have situations like this still ongoing, 22 months into the pandemic, vaccines are available. They are hosting a clinic I see this weekend, but like what can parents and students do to try to keep everyone safe as the virus still spreads?
Get vaccinated. Take wearing a mask seriously. Particularly if you're not vaccinated or you're in a family where some members are or aren't. Knowing that, particularly that if Omicron becomes more present here and it's more transmissive, then anybody who's potentially exposed may well spread it easier. So I think taking all those things into consideration are important. If you're out there and you've had 2 doses and you're thinking, oh, this is getting tiresome, now you want a booster dose, get the booster dose. Lots of people get flu vaccines every year. They know that it makes a difference. I just think people just have to realize there's some things we do control, and we ought to take as much control over those things as we can.
foresee like vaccine mandates? I know schools isn't directly, your area, but do you see that like becoming a thing where we have to mandate vaccines throughout expanding those vaccine mandates throughout the county?
I'd like to start with as many things to keep things as open and normal as possible. So, I would hope that, for example, taking away some of the places where people could go, movie theaters and restaurants where masks tend to come off. Maybe the loss of some of those activities would inspire some people to say, I'm going to go get my vaccine. This losing access to these things isn't worth it. I mean, for me, it's unfair to everybody else who's got vaccinated and is wearing a mask and doing everything they can to stay safe, to have people who've chosen not to do that essentially be making a choice not only for themselves, but making the choice for others, because if they do get sick and they're unmasked and spreading it, they're actually creating a problem for other people. So I'm hoping that, if we could be a little bit more limited in what people could do, that they would choose to prefer a more normal life over the restrictions of not being vaccinated.
On the paint branch situation, I just want to, there's a couple things I want to note about that. Obviously, the contact tracing team is still working on that outbreak. I think there are 17 associated cases with that there. The majority of those are actually breakthrough cases. So those were vaccinated young people. And I think it's important to recognize, as I alluded to in a previous answer, the 12 to 17-year-olds are now sick. Many of them are 6 months past their second shot at this point, and they're not currently eligible to get boosted. And so in that population, they probably just need to understand that you're largely protected from severe disease still, even if your immunity is waning, but you will likely see more breakthrough cases the further out from your 6th month of your second shot. And so that is why it's increasingly important, as County Executive alluded to use those other protective measures like masking and rapid testing, use of our testing sites for PCR. You just need it's a multi-layered approach. And when you recognize the vaccination layer may be starting, I don't want to say dwindling, because it's still effective in preventing you from getting super sick or dying. So it's still really effective, but you just may see more breakthrough cases in that population the further out you get from their second dose. And so I think it's important to understand for the students, particularly the 12 to 17-year-olds who fall in that gap of having not been vaccinated for 6 months, or being vaccinated 6 months ago and not being eligible for a booster. That population just needs to think a little bit more about the different strategies that they can combine.
You said that there were a number of breakthrough cases. Do you know exactly how many breakthrough cases there were?
I don't know, but I was told that the majority are breakthrough, meaning more than half. So I don't know that I have an exact number.
Okay, thank you.
Thank you, Megan. Next up is Steve Bonnell, Bethesda Beat. Good morning, Steve.
Yeah, it's still morning by a hair. I wanted to return to the Global Pandemic Center. I can imagine why Rockville was picked, but I wanted to kind of just ask you all, the location was still kind of being determined until, I guess, today. Why I guess, Rockville in terms for the location here?
I can't speak for the people who picked it, but I know that it's in the U.S. Pharmacopoeia building. So obviously you're in a building that has a lot of science. Rockville sits, a couple of metro stops from NIH. So it's close by. Rockville is actually the Twin Brook station. So you're only looking at, 3 stations, I guess, to get down close to Shady Grove, to NIH, and you're also close to stuff in Shady Grove. So it's a good location. It's a reason why I've been, pushing hard to get us to, think about White Flint as location of a life sciences center, which other people are now concurring with. It makes a lot of sense. And U.S. Pharmacopoeia, who's been engaged in this, had space in their building. There's nothing better than available space that someone's willing to give you. This is not the permanent location. They're looking for a much larger footprint. They're hoping that federal dollars come to actually create a full-blown pandemic, protection facility. This is not a full-blown facility. This is more like their offices as they work toward trying to secure federal funding for a proper facility with the labs and the other things they think are important.
Do we know how many people might work at this center in various capacities, or is that still TBD?
It's TBD. It's TBD depending on month. So it's double TBD. But this, what they're doing at U.S. Pharmacopeia is relatively small. They're not going to be doing research there. They're basically trying to lay the groundwork for the federal government to take this seriously enough to stand up a center.
I wanted to switch over to weekly testing for the unions for the coronavirus. I know this has been discussed at council meetings, but maybe Earl or someone else can field this. But when exactly did that start, just to jog my memory? When, I guess, was that, the testing for the 3 unions? When was that start date?
So the IAFF, the firefighter union, began on Halloween. So the 31st of October was the first period that they've been doing it. So they've been doing it for several weeks. They've done over, I think, 2,000 tests at this point. And the McGeo and the FOP came to agreement right before Thanksgiving. And so they actually started the week of Thanksgiving. And so we're coming to the end of the second 7-day period for them at the end of this week. So they've been doing it for just short of 2 weeks now.
Just an obvious follow-up then. What were some of the issues that were still being negotiated between the general union and the police union versus the firefighters being first?
Yeah, so consequences for failure to participate, what that would mean. Obviously, we also need to make sure that the consequences couldn't result in severe operational impediments to the departments, because that's been something we've been talking about with the vaccine mandate. We didn't want to, we have to balance for, wanting people to be tested or be vaccinated with what if we can't staff our correctional facility. And so we had to build in some allowances to cover that, what the progressive process would be. If someone didn't, what the detective process for someone to submit a test was, whether they got tested at a county site versus they conducted their own home test, and what information would be provided, who would have access to that information, because obviously they felt like the results of a COVID test were a part of their medical record. But obviously, if it's part of your medical record and it impacts your ability to come to work at a given time, that needs to be shared to a certain degree with management. And so those were some of the issues that I think we just needed to work through, and we're glad that we did. Obviously, we came to an agreement that we're pretty happy with, both in terms of the participation that we're getting, but also the teeth that it has with regard to, making sure that our employees are either testing or being vaccinated.
And one of the numbers that caught during the council meeting yesterday was the number of county employees, a very high number, was in the 80-85% range, but then school staff were even higher at 90-95%. And I know you can't speak for the school system, but I wanted to just kind of ask you, the school system is very high in terms of its vaccination rates versus the 3 unions have been negotiating with. Is there any thoughts you have on your end on why that might be?
So I think, I've said this a couple times during my testimony before the Board of Health. I actually think with a vaccine mandate, we would get to 95%. But what I think that we're missing is what happens to that 5% of employees that don't get vaccinated. There are not very many programs that we operate that could sustain a 5% reduction in staffing without there being severe consequences. We're having robust conversations, and rightly so, about public safety issues and how we staff and address public safety issues in Silver Spring, for example. Those issues would almost assuredly be exacerbated by a lack of staff if we lost 5% of our of any pool of employees. And so I don't think there's any debate around vaccine mandates do result in a increase in percentage of people participating. The question is entirely around how many employees that don't participate can you fire without there being collateral impacts. And I'm sure the county executive wants to comment on that, but I think that's the thing that we're most looking at.
That was the issue from the start. I mean, I wish everybody get vaccinated. I don't think there's a rational reason in the world why people don't get vaccinated. I do think that, frankly, that in a couple of these departments, political views conflict with vaccination. People don't believe, this isn't the only person in the country or the only group of people in the country who don't believe in vaccination and thinks this is either, a hoax or, unnecessary, or this is just a common cold. There's lots of false information out there. There are people who continue to spew that false information. And I think, unfortunately, we've got a couple of areas where our employee base may skew to people who, have taken that information seriously. I think it's wrong. I will tell any of them to their face that it's wrong. I don't have any problem doing that. I think they should get vaccinated. But at the end of the day, you can't complain about, response and service levels if you actually yourselves do things to undermine response and service. So,
as a former teacher, county executive, do you think, to fall on that line, that that's why teachers and educational staff, that number is higher, because we're seeing that perhaps nationwide? And
you certainly have an element of it. You've got like over 20,000 people in the school system. There are bound to be some people who don't agree with us. I'm pretty sure that's a pretty normal thing. And, normally disagreements are just simply disagreements. This is one that, bleeds over into the health area, and where disagreement is more than just an intellectual disagreement, it becomes a health and safety disagreement. I'm not happy. I wish it were different, but I think the school system, contemplated life without 1,300 staff members and realized that as hard as it is right now to teach schools and staff things, losing another 1,300 people would have been catastrophic for them.
No, thank you, everyone. And thank you, Megan Spivey, for her patience. Thank you.
Thank you, Steve. Good afternoon. Megan Doherty, WTOP. I believe you're the last one. Go ahead.
Hi, we are doing a double take here at TOP, having Jack asked a question already, so I'll be quick. Wondering how the cyber attack on the Maryland Department of Health is affecting the county's forecasting and just sort of an understanding of where we are with COVID, especially with the new variant. I understand that Dr. Bridgers had a meeting with health officers earlier. I'm wondering if that was about the data breach and if you have any other idea of, has the state offered any status updates as far as the data, and if there's any more information about whether it may have been compromised?
Well, I can let you know that we have been in communication with our state partners. They've provided some data updates yesterday and today to, again, help us track where we are with vaccinations. We're still waiting for a number of other systems to come online. Again, some of what we do does require an automated data feeds, but we are operating with information from them of where we are. We do suspect that some of what they're providing us may be a day old or more, and that automation helps us to be as current as we would like to be in providing information to our leadership who are making decisions, as well as to the community who are tracking along with us. So we are getting these, but some of these systems, in particular, some of the systems that we use to do contact tracing and share data with contact tracers at the state level, we're waiting for that to come online so that we can be exactly on the same page. But we are still doing that with our local contact tracers in the meantime.
I think a fair summary, and Mr. Don, please correct me if I'm wrong on this, but operationally, we haven't been prevented from doing any service delivery by the outage at the state. What we've been largely denied is access to information that would allow us to more, we know where we're at with regard to vaccination rates, testing, but also like the core activities of health and human services, vital records, and other pieces of information like that. We've been able to continue to enroll new people in programs and have them participate in programs, but often the knowledge on the back end of, the most obvious examples being the vaccination rate for our 5 to 11-year-olds, we've been getting that information much more sporadically, and it's allowed, it's had impacts on us understanding exactly where we're at, being able to provide to the public information about, what progress we're making. The other piece I would say is I don't think we've got any more information with regard to the nature of this outage, whether it was a vulnerability that was more recent, whether there's some, how long it's been vulnerable, what records from the state might or might not been compromised. There doesn't seem to be any indication of that, but I don't think we're getting any additional information with regard to that than they've released publicly to suggest. I mean, I don't know that we know that it was either a ransomware attack or any additional details with regard to that. It's just we've largely been operating in a similar fashion, really just focused on the operational impacts that it's having on our service delivery systems.
Gotcha. Not that there's a good time for a cyber attack, but it seems like it's an especially bad time if you're trying to figure out how Omicron is affecting the county numbers wise. So it's fair to say that we're about a day behind because they're holding back this data to make sure it's correct before they're passing it on to the county so that you then can make a decision based on that data?
I'm basing that estimation on things just not being automated, data feeds not being automated. So from the time to report to where we can share it with other folks, it just takes a little bit longer. So that's where I have my suspicion that we may be about a day behind with some of the data that we're getting from them.
Thank you.
But I mean, the other thing is we rely on the CDC tracker, for example, for vaccinations that the county executive showed in his opening comments. We don't know how often or what information they're providing to the CDC at this point. So when we see our 80.9% fully vaccinated number, we don't know if that's an accurate portrayal of where we're at today or if that's an accurate portrayal of where we were at on Sunday. And, because obviously the number is moving. So we just don't know what information is being provided to. So we know it's being provided to us. We just don't know whether that is similarly get provided to other places, or maybe they're more accurate with the federal government than they are with the localities. We don't know the difference there. So that's I think the I don't want to say the more troubling thing, but the more challenging thing is certainly we don't know how inaccurate our information is and how behind our information is. And I think what Mr. O'Donnell was largely alluding to is we're making some guesses based on how much the data has increased from the last time we got it, that this looks like about a day's worth of data. But we're guessing there, I think, in a lot of cases.
That seems like a bad position to be in. I mean, I'm sorry, but Dr. Starr, does that seem like if you don't know if the CDC data is right, or I mean, how can we be making any decisions?
I will say we're happy that we can proceed operationally. We're glad that there weren't massive impacts on the PrEP mod system, for example, which would have precluded us from scheduling clinics. We're glad that we can still provide the regular updates up through the systems with Immunet. We're glad we can still do most of the operational activities. That would be much more catastrophic in that case. But obviously, the state's lead agency during a pandemic response sending messages to the staff not to use their electronic devices for a period of time is a problem. I don't think the state would argue that it's not a problem. We're just hopeful. I guess what we have to say is it could have been a lot worse. It's not great, but we're hoping that they can get back operational as quickly as possible, and that's our focus. I mean, there will be plenty of time to ascribe blame or assert where mistakes were made. Our clear interest is much more just to have an operational state partner that can help lead and guide the state through the pandemic.
Makes sense. Thanks, guys.
Thank you, Megan. Thank you to the members of the media. I do not see any more requests for questions from reporters, so I guess we're done for today. Thank you, everybody, for joining us. Stay safe, and we'll see you again soon. Have a great afternoon.
Thank
Take
you
care.
all.